There are treatments in cancer today that are in the market that are curing patients that we didn't even know about 10 years ago, principally in the area of immune therapy, so harnessing our own body's immune system to really go after cancer. We've made tremendous breakthroughs there, and I see that playing out in many other disease states. We kind of started in oncology where the biological interactions and the way that the immune system can be harnessed was most obvious, but there's traction in metabolic disease, there's traction in neurosciences, and so I see this harnessing of system biology with better, newer drugs that kind of take advantage of our immune systems as opposed to kind of fight it, which is what we sometimes do. I see that on the medicines frontier, bringing us surprises that we never knew we thought about. We've had the first digital therapeutics, so entirely digital solutions that can be prescribed by a doctor and used by patient without going to the hospital, without taking a drug, but just changing behavior and understanding more about our system. We've seen that approved in mental health, in behavioral health, in respiratory health, asthma and COPD, for diabetes and metabolic syndrome. So I think we're gonna see much more in the area of new technology solutions that don't have drugs inside and don't have a doctor or a nurse telling us what to do, but are tools that we can interact with and shape our health. And then finally, I think we're gonna understand a lot more about the context we live in. There's a new science called exposomics, so it's really looking at all the exposures to sleep. Sleep is an activity, but think about exposure to pollution, exposure to stress, the extent to which we're eating a healthy diet and we're moving at the appropriate. We're now mapping that contextual understanding of what's going on with individuals into the sources of disease, and I think we're going to get a lot more traction on that in the next 10 years. And so, just in our walk through a digitally enabled life, we're going to get a lot more suggestions, have a lot better understanding of what's going on with our health in real time, and be able to be much more empowered to manage it on our own.